baseline information from the patient. So for this patient that I'm gonna do cervical manual traction on, I would just get a baseline of pain level in her neck, kinda like when we did a traction, pain level in the arm, and then how far down the pain is going in their arm prior to doing the test. So after you have your baseline measurements of pain and how peripheral symptoms, then you would begin the test. So then you have the patient lie back down. And then I'd have that bolster underneath her knees and come on out. And then you're just doing how I told you last week, just capping here and pulling on that, on our chin directly, just directly outward, like distracting, and holding that manual distraction and asking the patient if that pain is better, worse, or staying the same, and what's it doing to the arm. It's a positive test if it makes the pain better. And it's a positive test for either a herniation or spurring. Spur calcification. And that would be the, like we talked, this degree of manual distraction here is going to be that grade 3. So you're distracting at the grade 3 distraction intensity and holding it. You can relax for a minute. And then the same holds true for lumbar. You would just be doing the belt just like we did, and without her stabilized at the hips though. Remember, if it's true lumbar traction or manual lumbar distraction was where you're getting that straight on pull if it's just unilateral. So I'd have the belt around and then using my body weight to pull and just asking if the pain is better, worse, or staying the same, and what's going on peripherally. Just like we talked about though, for this amount of, if you're doing this test as on the patient, if they have any type of ankle or knee instability, it's contraindicated because you could disrupt the ligaments in the knee or the ankle if they already have a history of that. So this would be an inappropriate test if they have issues like that going on. Okay, so that's the manual distraction. So now we'll move to lumbar side glides. Jordan, go ahead and stand up. And come around here. You always want to have them, we've done them like just standing, you know, I showed you how to do it standing, but you want the patient to face me, or this face, and put their hand on their hip, and then feet should be shoulder width apart, and then they glide. And then come back to neutral. A common mistake in this side glide is that they do this. So I always get in front of my patient, or you know, turn around so it's exactly what they're doing. So you want to kind of let them mirror you, because if you stand and face them and they're doing the opposite, you're doing the opposite glide. So if I wanted, because what glide is this that Jordan and I are doing?
Left side glide.
Yeah, we're doing left side glide, which is treating what?
Right. Hernia disc.
Yeah, good. So they would have a right posterior lateral herniation, and they're going to treat that with the left side glide. And you want them to not go past neutral. So that's considered a way for them to do a self-active glide. So what kind of type of exercise would that be called, since Jordan's doing it herself?
Would it just be active range of motion?
Yeah, it's just an open chain isotonic range of motion exercise. Please do not get confused because she's standing that it's closed chain, because remember, you have to be you're talking about the muscles that you're activating. It would, in order for an upper body exercise to be closed chain, they have to be bearing weight on their upper extremities. So this is an open chain isotonic range of motion exercise. Two other ways you can do a side glide. One is with the patient prone, so they would be laying prone, and they would still have that shift. Just say that you have a right lateral shift. Now, how would you, if she had a right lateral shift, how would she be shifted? It's her, where would her shoulders be? Jordan should be moving her shoulders. Remember, the lateral shift is named for the way the shoulders go. So if I said, I need you to act like you have a right lateral shift.
Shift to the right.
And her shoulders, she would stand up and look like this. So how do you correct a right lateral shift?
The left side glide.
Oh, right side glide.
Yes, the right side, because I'm here. So I'm gonna correct, I'm just correcting the shift. Not the disc now, I'm just correcting the shift. I'm just saying I'm gonna correct the shift. So she shifted to the right, so what am I gonna do with her hips? I'm just going to move them over. So you physically move them over. So move your hips over to the left. And then you physically move them over. And then hold them there. Because patients are not, their body wants to be shifted. So you're basically just taking their hips and moving them over. What type of exercise would you call that? Because I'm doing it, so it's a manual therapy technique. So I'll ask it that way. I want you to do a manual therapy technique. So that would be more of a manual therapy technique. Okay, so that's two ways now we know how to correct shifts, is by doing just a standing side glide, a prone assisted side glide of the hips, and then you can have the patient standing, so stand up. Still stand like this. And then all you're doing here is you can come around with you and move forward about 2 steps. And then you just sit on a stool next to them and you put your hip over, like you're gonna pull their hip and you're gonna have your shoulder, or you can use your arm to move it over. Some people actually use their body, which is if they're really shifted, it's better to do that. To like kind of stand, but it's harder, I think, and move them over, like using your shoulder, shifting them over. If they are really shifted and you're having a hard time doing it, you can come in here and kind of push this way. So what kind of glide am I doing?
Oh, right side glide.
Yeah, I'm just doing that manually. And what would Jordan's diagnosis be there? If I would have that